So outside of work, I spend time with my family. I have a 3-year-old daughter and a 4-month-old son. We love the outdoors. We like to go up to Lake George whenever we can. After I help with the kids in the morning, wrestling them to get them off to school, I actually take the ferry into Wellsheet's Manhattan offices, typically, which is beautiful. You get to see the Statue of Liberty on the way to work, which is always inspirational. Spend the day in the office, usually between meetings, Zoom calls, back to back. Try to get home in time to help put the kids down for bed and then work some more before going to sleep. So I founded Wellsheet after working at IBM in their Watson Health division. So that's where I saw the immense frustration that physicians faced with existing technologies, especially electronic health record systems, which in many respects were not designed for them. And arguably the most important function in our society had to deal with really antiquated technology and frustrations that come along with that. Clinician burnout is one of the biggest problems facing the healthcare industry. And in fact, it's created a very serious workforce issue where nurses, physicians are no longer wanting to practice because of the burnout and the burden that's placed on them. And a significant portion of that burnout is attributed to electronic health record systems. And I was excited about the opportunity to create a solution that much more effectively supported clinician needs and really augmented the experience with electronic health record systems. And right around the time Wellsheet was started, the advent of APIs, which actually allowed for effective integration into EHRs that was scalable across the industry, just started to come to market. So if you think about electronic health records, they're designed in a static way. So whether you're a cardiologist or an endocrinologist, the data is presented to you in the same fashion, even though you're looking for very different things for different patients and different scenarios. So Wellsheet's designed to predict what content is most relevant for a particular clinician to know about a particular patient based on the clinical context. So the physician's specialty, the patient's reason for visit, their set of diagnoses, the physician's practice patterns, how they interact with our technology over time are all incorporated into this predictive ability that really focuses on what's most important for that particular clinician-patient interaction. The impact that Wellsheet has had for clinicians, the tens of thousands of users that interact with the system, and just the tremendous relief that it provides them. So our goal as an organization is to get that relief to as many of them as possible. And ultimately, we intend to become a ubiquitous engagement layer that the clinician goes to really get access to all of the clinical information they need to make treatment decisions for patients, regardless of the underlying electronic health record. And we can overlay any underlying EHR system as well as multiple EHR systems into a single view. So we're really focused on being able to bring this to as many clinicians as possible. We built the technology really on a foundation that was anticipating this immense scale that we would ultimately need to support from day one. And a big part of that is the APIs that we sit on top of. The integration layer is more scalable than anything that was available before they were released by the electronic health record companies. It's a very significant transition that's occurred in the industry that we are benefiting from. So we create a positive culture by really caring about the clinicians that we serve, by having the whole Wellsheet team and community focused on those clinician challenges and the frustrations they face, and caring about what they need. So for us, our mission is to address that EHR-induced burnout, really bring that burnout under control, address the pain points that exist with current systems, and make clinicians' day-to-day practice easier so that they can focus on delivering the best care to patients.